Hi, my name is Rich Lafergie, and I'd like to take you through my journey for rehabbing after some rotator cuff surgery. This is about 8 weeks out, and I'm in pretty good shape in terms of active mobility, which in English means I can move my shoulders in a pretty good overhead position, um, kind of going a couple of different ways. And to give you an idea of the progression that happens with shoulder surgery, rotator cuff surgery, in the first couple of weeks, it's really about getting off the narcotics and the pain meds, transitioning to regular Tylenol or nothing at all for pain, transitioning to be able to sleep through the night because repairing yourself with sleep is a really important part of the rehabilitation process. In this first month, you'll see your physical therapist a few times a week, and they'll be working on just massaging the tissues. Going into the second month, if all goes well, you can get your sling off, although you'll still need to wear your sling when you're working out or when you're sleeping. And you'll start to work with your physical therapist in passive mobility, which means that they are going to be doing the movements for you in terms of the range of motion progressions for your shoulder. Going into month three, you can start to do things like running again, using the rower. This is what I started to do. And then you're going to start to work on active mobility where you are moving your shoulder into a range of motion on your own. What's really important is to push on the end points of the range of motion, because at the end game is the more open shoulder positions, end range positions for a snatch and for a muscle up. So this is really what you're shooting for. So going into month four, you will be doing more more active mobility, and you will be starting to use a light PVC or a training bar and start to do some cleans potentially at some really light weights. Month five, you'll progress into shoulder presses. And month six is when you get to the end of the rainbow, hopefully, where you'll start to do snatches and you'll start to do muscle ups again at the end of the range of motion. What's worked for me is listening to my orthopedic surgeon, Dr. Kevin Stone, in terms of getting on a sweat every day. Almost from day two, from shoulder surgery, you want to start getting a sweat, get the hormones moving so that your body starts to repair itself. See your physical therapist 2 to 3 times a week. It's less important potentially in the first month or so. There's going to be general mobility. You want them to move the tissue around. But once you start getting into 3, 4 months, you want to see your physical therapist a couple times a week, because you're going to be doing a lot of mobility with your operative shoulder, and you're going to want to make sure that you're getting as much range of motion pushed into your shoulder through your physical therapist as possible. You'll also want to do physical therapy on your own. This is essential. This is more important than working out every single day, is doing your own physical therapy. Icing twice a day is really, really good. And, I think the must-haves are some sort of icing system, whether it's ice bags, whether it's reusable ice packs. There's the Game Pro, which you'll get right after surgery. There's a thing called the Squid, which is a really good icing system, a little bit on the pricey side. The other thing is a shoulder sling, or something called that's called Incrediwear, that puts your shoulder, lifts it up, and they claim to increase circulation. That's something that you want to do. And really, some of the other stuff that I do is I take an infrared sauna every single day, and I use a bunch of other tools. I'm also working with a remote physical therapist, Dr. Chris LaGreca. And, the interesting progression from him is that, most physical therapy for rotator cuff post-operative rehab is for the general population. It's really not for the functional fitness athlete. And really what you want to do is, as you are getting back to where you can start to use your shoulder again, you want to be working on your non-operative shoulder so that it is strong. So you'll want to work your core, you'll want to work your legs, you'll want to work your conditioning, your aerobic system. But also the most important thing to do is to work on your non-operative shoulder, getting that strong, getting all the ancillary muscles strong, so that once your operative shoulder comes back online, you'll have the stability and strength to handle that. So hopefully that helps. And please get in touch with me at rich@archeradvisors.com if you have any questions. Thank you.